Why did I revise my book? Because this will be the fourth edition that I believe will be coming out after the first of the year. Um, Springer did a survey of faculty who had adopted the book, and that was very helpful in identifying the need for increased content on specific topics. Some of these were things like the social determinants of health, diversity, equity, and inclusion, plus content on developmental disabilities and complementary modalities. So all the chapters were revised, edited, and updated with theory and research, and all of this without adding to the number of pages in the book because we didn't want to make it any longer than it is. So updating the framework in chapter 1 includes more emphasis on the social determinants, not just the adverse experiences an individual has, but also on cultural contributions and social contributors to mental illness. Also in the chapter 1 and 2 is research on resilience and relationship. Chapter 4, which is sort of the how-to or the nuts and bolts of providing a psychotherapy framework, includes more on telemental health, which is quite flourishing, and digital therapeutic apps for use in PsychMP practice, which are evidence-based, and also more on legal and ethical issues, suicide prevention and assessment. This edition has 23 chapters, and it's organized similarly to the third edition, with the first 4 chapters providing an overall framework for practice based on relationship and resilience. And it's trauma-informed, which serves as a compass for building resilience for oneself and for our patients. The next section of the book, which is 9 chapters, has 9 different specific therapeutic approaches, including group for 1 chapter, family for another, CBT, psychodynamic, etc. So faculty can then decide to, after the student has the foundation of the first 4 chapters, to assign specific chapters that faculty think are important or approaches such as CBT or psychodynamic. There's newer content also in the third section, which illustrates how to integrate medication and complementary modalities into treatment. Social rhythm therapies included. Chapter 14 is reuniting psychotherapy with psychopharmacology. Many of the jobs that PsychMPs are employed end up being prescribing. So how does one prescribe and also integrate psychotherapy into their prescribing practice? There's a section on CBT and medication management. And the child chapter, which is in the special populations section, now includes therapy on developmental and intellectual disabilities. There's more of an emphasis on integrating the holistic framework of resilience and relationship for practice into each approach, more case studies and application of each psychotherapy approach that illustrates how to integrate when prescribing, where appropriate, and psychotherapy. And case examples also include rationale for when not to prescribe and just conduct psychotherapy. There's review questions, as there were for previous editions, at the end of the chapter, and I think these are really helpful to generate classroom discussion. This edition will also include a test bank of certification questions and other faculty resources, such as simulations, links to videos, case studies, and PowerPoint slides for each chapter. And all of this will be on a website for faculty. All the appendices will be on a website for students and for faculty, and these will be in edible form, not edible like eating, but edible like you can fix them the way you want them. And that'll be a website for both faculty and student access.